So what we just finished is something called a pulmonary artery thrombectomy, and we use something called an inari thrombectomy device. So a lot of patients could get clots in the legs, and this clots called deep vein thrombosis will typically then travel from the legs into the lungs, and they can cause a variation of pulmonary embolus, which means clots in the lungs. And for most patients, when they have a small amount of clots in the lungs, we just give them anticoagulation. But we do have a subset of patients who have something called submassive pulmonary embolism, or massive pulmonary embolism, meaning the heart is now having a lot of strain or a lot of difficulty to push against that clot, and those patients could do very badly. So in those cases, we can basically go from the vein in the groin and go into the pulmonary artery with this inari device. And basically what we're doing is we're basically just pulling out a bunch of clots. And what we've seen is that when we can get out a lot of clots in a small period of time, this patient's oxygenation requirements significantly decrease, and they can get out of the ICU earlier. Also, there's a lower chance that they will develop something called pulmonary hypertension in the future. So this is a new device that we have now available as part of our armamentarium, and we're quite excited about it because now we can use it in Nigeria.